Question number 2, again by Dr. Imjad, in a series of 5 questions to address, and I'm really trying to give a 2-minute answer here because I can give a lot of details, but then it will become a whole lecture. And I do have lectures, and I will put lectures online for you guys to watch on the computer. And my hope is to summarize the essence in 2 minutes that you can remember and take, without enough information to maybe convince you, but if you need convincing for that point that I'm trying to make, then watch a whole lecture, and I will try to convince you longer. So question number 2, is there any treatment that delays disease progression? The short answer is no. Now here's a long answer. Currently, many of us experts believe that if you do different types of exercises, that you does not have as many complications or as bad or as early complications with Parkinson's disease. Your symptoms progress differently, look differently. Does that mean it's slowing down disease progression? I don't know. That's how I tell it to a lot of my patients, but not necessarily. Their disease is progressing, if you measure with a proper biomarker, but they're less likely to have falls. They have more likely to have good speech, not have hypophonia. They're less likely to have stiffness. And it may be that it's just doing more exercises is making them feel better, but there is something to it, and I think we should use it. And we should convince our patients to feel better and be in a better group of patients by doing exercises. There are some medications that were studied and came close to being proven as neuroprotective or slowing down Parkinson's disease. Selegiline is one, razagiline is another one, and are they neuroprotective? We don't know. We don't know for sure. Some of us like to believe that there is enough evidence there that it's convincing to us, although it was not convincing to larger bodies or organizations like FDA. And sometimes we use those medications with that hope. So a young patient, mild disease, I may be tempted to start one razagiline or selegiline, hoping that it will actually slow down disease. I use the word hoping because, again, I don't have enough evidence to convince you beyond doubt that they actually slow down the disease. There is even the trial done with levodopa to see if it's toxic and damages brain. The L-DOPA study in 2005 actually showed that patients were much better if they were treated with L-DOPA. In a sense, there was a hint that maybe it is actually neuroprotective, and that debate is out there, although most people are not convinced, because we use L-DOPA or levodopa all the time, and we don't see neuroprotection per se. Who's the control group? Everybody's on levodopa, so how can you tell? Symptoms do get worse over time. If you don't use medication, and then symptoms are much better. But does it really slowing down the disease is questionable. There are many drugs in the pipeline that are being looked at to see if they will slow down the disease. So I'm sure some of them probably do, and we'll find out soon enough. But we don't know for sure right now. Interestingly, there was a recent trial to look if deep brain stimulation surgery slows down Parkinson's disease, or DBS surgery, or DBS. There are two important questions to that. One is amazing that we're looking at stimulation, a symptomatic therapy in the brain, to see if it slows down Parkinson's disease. And it actually shows that possibly it does. And now there was a paper published in 2019 which showed that if you put stimulation in striatum, I think in mouse models, you actually reduce the burden of Lewy bodies, or an amount of Lewy bodies or disease in itself. So there may actually be some sense in why stimulation slows down Parkinson's disease. But the most interesting thing I found out when looking at the data on the DBS for slowing down Parkinson's disease, they actually reported slowing off not the Parkinson's disease as a whole, but one individual symptom or component. So the paper actually shows that the early deep brain stimulation surgery, on average about 2 years after the onset of disease, slowed down the progression of resting tremor. Not the whole Parkinson's disease, but the resting tremor itself. That's very interesting. And if you think about it, if you go back to my earliest point about exercise and Parkinson's disease, I just said that patients who exercise don't develop certain complication. Is it slowing down Parkinson's disease as measured by those complications? So if your patient exercises more regularly, he will have less fall. Have you slowed down the balance component of the Parkinson's disease and not the disease as a whole? Maybe you have. How would you tell? Maybe other things have happened in the brain that looks as if your patient is not doing as bad as if he would have otherwise. Is that slowing of disease? Or is the slowing of disease only decrease in loss of substantia nigra neurons, which is the actual pathology in Parkinson's disease? But it's not the full pathology itself. Or is the slowing down a decrease in Lewy body burden in the brain of Parkinson's patient? What exactly is slowing down of the disease? So that's an interesting question, but can you look at individual symptoms not becoming worse over time rather than the whole Parkinson's disease itself? That was an interesting part, looking at the data from deep brain stimulation surgery.